All right. Good morning, everybody, and welcome to 2022. I'm Heather Thomas with the Snohomish Health District and the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a moment to click buttons to make sure that all of the media have permission to record. As always, you will have permission to record, and we will also be recording and posting that on the Snohomish Health District's website later today. So give me just a moment. Okay. Looks like I have most people, but if for some reason you don't have permission, just send a note to the Joint Information Center in the chat box and I will get that fixed right away. All right. This morning we are joined by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of our speakers will provide an update, and after their remarks, we will take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see those questions. We also did receive a couple questions from a reporter in advance of this meeting, so I'll be typing those in the chat as well. With that, I will turn it over to Executive Summers.
Great. Well, thank you, Heather, and Happy New Year, everybody. I was mentioning it's a balmy 32 degrees here at our place, so things are looking up. But as you'll hear from Dr. Spitters in a few minutes, we're once again breaking COVID records in Snohomish County. We're really at our highest levels of the disease since the pandemic started 2 years ago. So it's some bad news. And it's really easy to get caught up in numbers and see data and just really view it in abstract terms, but we really have to remember the human component that each and every one of the numbers is a real person, it's a family, and it's affecting businesses, schools, all our lives. So the human component needs to be forefront every day. That data just doesn't capture kind of the trauma that comes along with COVID potentially. So we've spent about 2 years dealing with frustration and pain of COVID. Now my family has been impacted. I found out Monday I tested positive for COVID-19. This is really despite being fully vaccinated. I've had 2 shots of Moderna and a follow-up booster, and I've been very careful to follow public health recommendations, but I got it anyway. I suspected for a long time, and I think we've known for a long time, that because of the nature of the virus, you know, at some point, everybody's going to be exposed to it. And we've been working hard to manage the impacts on our hospitals and clinics and testing facilities and buying time to get the shots out. But the really frightening part of catching the disease, at least for me, is that my wife is immunocompromised because of critical medical treatment she's receiving. So that puts an extra emphasis on the importance of really protecting ourselves as best we can to help protect others that can be even more vulnerable than so really the data doesn't explain sort of the real impact on people's lives, but we've just got to be smart about this. My symptoms were mild. They really lasted about 3 days. In fact, I was tested after my symptoms were mostly gone. So I'm going to recover. I'm not worried about that, but I'm very worried about other people. And I've got to say, this is brought home to me during the pandemic. Early on, when we started asking people to wear masks, there were, you know, certain people that it was quite clear they were not going to do it. And it was irritating to see that in grocery stores and out in public. Kind of tell some folks were taking pride in not wearing masks. Now it's got a new meaning to me, because those people are not taking a simple step to help all of us, whether it's me or my wife or anybody else that's immunocompromised or really vulnerable to the disease. So we just really got to double down and realize this is not about us as individuals. It's about our neighbors, our families, our friends, and masking in particular, and getting vaccinated on top of that, or just acts of kindness to other people around us and to our communities. And I also think about healthcare workers. I think we're going to hear a little bit about that, but our healthcare system is just strained to the max. The ability to care for critically ill people is really stressed. Workers are tired, and that's the biggest, one of the biggest impacts of this, even though this new variant seems less damaging in some respects. It's so contagious, and there's so many people, and there's still people that are vulnerable to it, that it's really taxing our system. And so we've got to just really double down on masking, social distancing, and all those recommendations we've been talking about. So I think just encourage everybody to get vaccinated, get your boosters. We've been using surgical masks. I'm up to a N95 type, up your protection as much as you can. And just remember that family members across the region are just really proof that this works, but also proof that we need to keep going on that, on these protective measures. So with that, I'll hand it off to Dr. Spitters.
Well, thank you, Executive Summers, for sharing those comments. And you know, your experience reflects what I'm seeing in my personal life as well, although it hasn't hit as close to home as it did for you. And I'm glad for you that it was mild and you're recovering, and I hope the same for your wife. There's certainly many people in my personal life who are fully vaccinated, boosted, and very careful, who are experiencing exposures, getting quarantined, or testing positive for COVID. And it speaks to the tremendous increase in the ability of this strain of the virus to transmit from one person to the other, and overcome barriers that we erect to it, like masking, distancing, vaccination. And yet, those shouldn't be considered a failure of those efforts. You know, first, all those efforts reduce the dose that one gets if you're exposed, and that the smaller the dose, the less likely infection is to be established or to cause severe disease. So that's one good thing. And also, we really want to try to continue all these efforts because, you know, our goal, a rational goal, is not to eliminate COVID. That's not in our future. You know, we're not going to declare unmitigated victory over this virus. And as you said, in the long run, we're likely all to get exposed and infected with this, just like we've been exposed and infected with many or most of the other coronaviruses that are now endemic in humans throughout the world. But what we can do is have the outcome that you've experienced, which is a mild case, not getting sick enough to need hospitalization or intensive care. And I think that's really the key thing. We want to reduce transmission to protect as you said, the healthcare system that is strained to the max, other essential societal functions like education, and, you know, we could all list a long list of those, and protect our individual health from severe disease. So I think that's kind of my take on your experience, and it really reflects what's going on in the community. To the press crew, good morning, and I wish you a peaceful and healthy new year. Unfortunately, as you're all aware, the Omicron variant poses a significant challenge to our health and peace of mind. DOH, Washington State Department of Health, recently reported historic levels of infection in Washington, and we're seeing that here in the county as well, as Executive Summers mentioned. For the week ending January 2, there were more, or January 1, there were more than 5,500 new cases reported. That's last week, nearly double the 2,800 cases reported the previous week. And that in turn was almost double the prior week. So we've had 2 successive doublings, and that's kind of what this virus does, especially the Omicron strain. That brought our rolling 2-week case rate through Saturday up to 997 cases per 100,000 residents. Basically, that's 1,000 per 100,000. That's 1% of Snohomish County residents became reported cases in Snohomish County in the last 2 weeks. If you account for the fact that we don't pick up all the cases, not everyone gets tested, people with mild infection or people who couldn't get tested, it's probably more like 3, 4, even 5% of the county got infected in just the last 2 weeks. This rate of transmission and these case counts are higher than at any point in the pandemic. But sadly, I suspect we'll see both of these increase again next week and likely more in the weeks to come. Statewide projections from the Institute for Health Metrics and Evaluation suggest that we'll see a peak in hospitalizations in mid-February through mid-March at a level slightly below the peak of the last wave, although our current figures, which I'll share in a moment, make me think that maybe that's an underestimate of the hospital impact of the current wave. Likewise, deaths are predicted to be less than in prior waves. For example, in Snohomish County, translating into roughly 10 to 15 weekly versus our prior peaks of 40 to 50 weekly. But those are still substantial. Every one of those people who go leave family, friends, and colleagues behind. The infection numbers projected by IHME show a statewide peak at 35,000 cases a day statewide. That'll just blow the lid off of prior historical totals, as we already are seeing occur. And that would also translate into about 6,000 reported cases a week and a peak 14-day reported incidence around 1,500. These are rough estimates based on assumptions with quite a bit of uncertainty, but we lay these out there for folks to understand that that's the general forecast of where we're headed. And in fact, I think things may be worse than predicted thus far, given that our current numbers early in this wave already approach predicted peaks, and we probably have 6 to 8 weeks to go before we actually reach the peak. Researchers are still studying the impact of the Omicron variant on vaccine immunity, but we should expect lots of breakthrough infections among those not fully boosted, as well as reinfections among the unvaccinated. Severity of Omicron remains to be determined formally, but preliminary observations elsewhere and here is that the proportion of total cases hospitalized and dying is lower than with previous strains. However, as Executive Summers mentioned, the high transmission and huge numbers are leading to similar numbers of hospitalizations just because of the large number of people infected. To give you an idea of the impact on hospitals, on December 24, 34 Snohomish County hospital beds were dedicated to COVID patients. By December 30, just a week ago, that was up to 56. And yesterday we reached 101, approaching prior hospitalization peaks and suggesting that our local healthcare situation could end up being even more difficult than the statewide picture predicted by the IHME modeling. A similar surge in hospitalizations is being seen throughout the region. In the outpatient setting, available appointments for testing are taken, with many providers booking out 1 to 2 weeks. Walk-in clinics are seeing wait times exceeding several hours and are having to limit the number of tests that they do. So this is not only about individual health, but the integrity of the healthcare system that provides care for all conditions, and that now appears to me as running on fumes, especially with respect to limited staffing, progressive burnout. I think the healthcare system is in as precarious a situation as it has been since the pandemic started. We continue to ask more of them, and their efforts have been and continue to be heroic, but they're getting tapped out. So here's where our community can step up and relieve the burden on the healthcare system, preserve it for its essential role in taking care of all of our healthcare needs, as well as preserving other essential societal functions. If you're not already vaccinated or boosted, sign up as soon as possible. You may have to wait a couple of weeks for an appointment, so make that call today. Being vaccinated is crucial, and it's been shown in laboratory data looking at antibodies from fully vaccinated individuals against the Omicron variant. Those the ability to neutralize or kill the virus in the test tube is lower for folks who have only had 2 doses. But if they've had the booster, then their antibodies are as effective in the test tube against Omicron as they are against Delta and previous strains. So even if you're fully vaccinated, you're not done yet. You have to get that booster if you're eligible. Also, if you are fully vaccinated, that's no ticket to abandon caution with infection rates this high, and as Executive Summers and many other people's experience is indicating to us. Remember that the vaccine's job is not as much to protect you against getting infected, but to protect you against severe disease and the need for hospitalization. And remember that if you get sick, you can still spread it to others. So don't stop being careful, even after being fully immunized and getting a booster. Also, get a flu shot if you haven't already. Flu is emerging in the county and state, and it too can take up hospital beds and put pressure on the healthcare system, and is a major cause of death in the winter months among people who are older and who have underlying health conditions. So please, make an appointment to get that flu shot as soon as possible. That can be done at the same time as your COVID shot. Masking up when outside the home every time. Speaking of masks, as Executive Summers mentioned, it's time for an upgrade. While cloth face coverings are acceptable to meet the Secretary of Health's mask mandate in public indoor settings, we recommend a higher level of mask quality and ensuring good fit. Examples include the KN95, KF94, or even a simple medical procedure mask, just those blue or yellow masks that you can buy at any home improvement or pharmacy, as well as get them on the internet. And you can wear that alone, or you can what I do is put on one of those and then put a cloth mask over that to kind of tamp down the areas where the medical mask might leak. Keep it over the nose and mouth at all times. If you pull it down to talk, that completely defeats the purpose, since when you speak, you generate all those aerosols that transmit to others. Don't pull it down to talk, cough, or sneeze. Only take it off to eat, and ideally eat in private settings or away from other people. Ventilate indoor spaces at work, home, leisure. Keep the air moving, getting the virus out of the room. Avoid unnecessary travel and unnecessary gatherings, especially if you or your close contacts are older or have underlying health conditions that increase the risk of hospitalization. If you have to go, keep gatherings well ventilated and short in duration, and keep that mask on all the time. If you're not feeling well, stay home. As I mentioned, we've got influenza, other respiratory viruses, but most of what's out there is COVID, and none of that do we want to see spreading around. If you test positive and are a close contact, follow the isolation. If you test positive or are a close contact, please follow the isolation and quarantine guidance. The number of cases being reported far outstrips the public health system's capacity to reach every case and contact. So don't wait for public health to call you to start your isolation or quarantine. And this brings me to my last 2 points. If you don't need a test for medical purposes, please defer getting tested so people who need it because they're sick or have been exposed can get one done. Also, if it's not an urgent medical condition, if you're just mildly ill and don't have any risk factors for severe disease like immunosuppression or heart disease, lung disease, or advanced age, just think about staying home and trying to do a telehealth visit. Because right now the number of tests that are available are fewer than the number of people seeking tests. So let's try to focus tests on those people for whom it would do the most good. Having said all that, and asking, if you have a mild illness again and you don't have risk factors for severe disease, it's okay to just stay home. You don't have to go to urgent care or the emergency department. That further burdens them, and it's unlikely to change your outcome. Having said that, if you develop severe illness, like a cough that just won't stop or difficulty breathing, or if you have other medical problems like chest pain, weakness, abdominal pain, things that could be signs of a heart attack, stroke, appendicitis, other kinds of serious medical conditions, do not stay away from the emergency department. Remember, we saw that early in the pandemic where a lot of people had other medical problems. They didn't go, and they ended up worse off later. But we're just trying to keep mild illness out of the emergency room, especially mild respiratory infections in otherwise healthy people. We ask your patience and forgiveness for this situation is changing rapidly, so please be ready for and don't be surprised by frequent updates and guidance as this evolves. The next 3 to 4 months, particularly the next month or two, is going to be rough on everyone. I know we're all tired. I know we've seen this, we've been at this for 2 years, and we're all ready for it to be done, but it's not done with us, so we can't let up. I'm asking Snohomish County to pull together and continue as you've done before in surmounting the challenges that this virus poses. And I appreciate all the efforts that everyone's been making to mask up, stay spread out, avoid gatherings, and get vaccinated. So with that, I'll turn it back to you, Executive Summers.
Great. Thank you, Doctor. First question we had is, I've learned from multiple general practitioner doctors in Snohomish County who are also parents that believe, based on what they're seeing with Omicron, that a temporary return to remote learning is warranted. Do you agree or disagree? Throw that one to you.
I think at this point, I would disagree at this point. I think our K-12 schools, the mantra has been they're the last to take out of action and the first to put back in action. I think we saw both the educational, social, and psychological impacts of keeping kids out of school during 2020 had significant impacts, and so children typically have much more mild disease, all the more so with this strain. That doesn't mean there won't be hospitalizations or bad outcomes in children, but you have to think about the other serious problems and bad outcomes that would occur if we keep kids out of school. Now that something could change that tips the scales there, but that's how I see it at this time.
Okay, next question is, I'm hearing cases requiring hospitalizations at Providence from COVID have quadrupled in the past few days, and the kids and young adults are getting very sick. One day this week, Providence had 50+ people waiting for beds, and they have serious capacity staffing concerns. I'm also told they paused elective surgeries. How fragile is Snohomish County's healthcare system right now, based on what you know?
Well, those vignettes which you share in your question speak to it, and that's what we're seeing and hearing as well. I think just to revisit what I said earlier, we've got about 100 people in the hospital with COVID right now. At the peak, the first wave, and I'm losing count now, but the most recent wave that ended back in September, and then the first wave, we peaked at around 100, 120 people in the hospital. So we're right there right now. The hospital is stretched, 12 to 20 new admissions per day just at Providence, long wait times in the emergency room. The hospital, the healthcare system's in a precarious situation. And we've all got to do everything we can to mitigate that, not only by trying to prevent transmission amongst ourselves, but also using testing and using the emergency department judiciously, using emergency for emergencies, and on the other hand, not staying away if you really do belong there.
So next question, are we in an endemic stage with COVID, as you even suggested today, no longer a pandemic? That implies we just need to live with it.
Right. Well, some of this is semantics. We are, it's endemic in that, we're not going to eliminate transmission of COVID. And so it's here. But it's because the population's immunity is so young and relatively limited. It causes these huge waves that have society-wide impacts and a lot of health impacts. Over time, that should gradually reduce as vaccination, infection, and passage of time, gradually these waves, I think, will get smaller and spread out. And the prediction is that it will become a seasonal virus that still produces substantial morbidity and problems every winter. But right now we're in a stage where it's just doing it one wave after another. Ultimately, we'll get to that state that I just described, which many attach the word endemic to. And it has a calmer and less urgent characterization to it. And in that sense, I don't think we're in a calmer and less urgent situation where things right now for the healthcare system are as tough as they've ever been, and they're probably going to get tougher. So we're not there yet.
I would just add to that, going back to the point that it's bad right now. Our hospitals are stressed, but imagine what it was like if people just gave up wearing masks or stopped getting vaccinated, how much worse it could be. So again, we're trying to manage as best we can the rate of transmission and sickness, and really try to help out the healthcare system to be able to deal with this. And so, it's clear to me we got to keep going with our protective measures as best we can.
Absolutely.
Is there a significant difference in risk of being exposed to Omicron dining outdoors versus indoors when the outdoor tables are close together?
Well, certainly Omicron is more transmissible than Delta was, and Delta was more transmissible than its predecessors. But if we just go back to the general principle of airborne disease, dilution is the solution to pollution, is kind of the old saying. So outdoors is better than indoors. Spread out and far away is better than close together. You can get infected with Omicron or prior strains if you're close, face to face, kind of living in the cloud of someone, even if you're outdoors. Conversely, if you're spread out, wearing masks, and in a well-ventilated indoor space, you're probably safer than outdoors side by side with someone who's ill and you're not masked. So each of the various prevention measures, including outdoor versus indoor and ventilation and masking, they all add up to add layers of protection.
In the same vein, what can you tell us about where spread is happening most? Bars, private gatherings, schools? Do we have any information on that, Doctor?
No, I don't. And I think that When case counts are lower, we're able to get a hold of most or all of the cases and ask lots of questions and try to get a better idea of what's going on. Right now, transmission is widespread, and wherever you are in public, indoors, it's potentially a risk, and that's just the way it is. There's no zero risk environment, so it's all about trying to reduce risk by avoiding places that are really crowded and all the other prevention measures. And I think as this rolls along, we're not, as I said earlier, we're not going to reach most of even a substantial proportion of the cases. There's just, the numbers way outstrip the capacity. So it's, one, we'll have less information than we did before about these things, and it's really going to be on people to know, or at least look up and apply the isolation and quarantine measures to themselves, because new cases and contacts are unlikely to hear from public health during this wave. There's just insufficient capacity.
I'd say the simple rule is the more people you're around, the higher your risk, and the more uncontrolled the situation is, the higher the risk. And even if you're taking protective measures, you're still vulnerable to others who maybe are not, and in close proximity. So it's just kind of common sense to try to limit your exposure as much as possible. What are the county's plans to open up more testing for people?
Well, the testing shortage derives from the tremendous surge in demand. The number of available tests hasn't really changed much. In fact, the number of tests being done has gone up, but the number of slots in the healthcare system that are available are limited, even more so by the healthcare staffing shortage that the entire system is experiencing. So that's a formidable challenge, and it may not be fully resolved until we get to the other side of this wave. But in the meantime, we are talking with the state about possibilities of getting state support for additional testing in the county.
Sorry about that. This fall, we were seeing spread among young people. Has that changed, or what are the age trends that we're seeing now?
Yeah, we haven't looked at it. I haven't seen age breakdowns of what's been going on in the past 2 weeks or so. We'll be looking at the data from December, getting analyzed this week or so, and be able to provide you more information in the report the monthly report that we post on our website and in our next briefing.
Okay. When do we get to the point where the health district is going to recommend some schools or districts pivot to distance learning, or is being in school safer than at home?
Well, I think I kind of addressed the part one of that question earlier. I think at the current time, my sense as the health officer is that there's insufficient evidence of harm to children to warrant pulling them out of school and then imposing those harms on them. But that's a team sport. School superintendents and local health officers have individual and joint powers and duties there, as well as the state superintendent of instruction and the governor. And so, I think we're reticent to act alone on that. If we feel like the time comes, we'll probably get in discussion with our state partners. And these are things that would probably be done on a regional or statewide basis. My sense is that as bad as things are right now, again, pulling kids out of school isn't probably a net beneficial to them or society. And again, their parents largely have to work. And so where are those kids going to go during the day, or what are their parents going to do? That imposes additional burdens. And many of those kids will gather in other places, as you're suggesting. So I think right now the best place for kids to be is in school. If that changes, we'll certainly be working with our education partners to try to address that.
Any thoughts on the Fed shortening the time between initial vaccine series and boosters to 5 months when other countries seem to be going to 3 months?
Yeah. Well, these are, broad policy decisions that are based on a variety of factors, including science and practical things and feasibility, as well as prioritizing available resources. And so, I trust that the FDA's authorization for the Pfizer booster to be administered now 5 months after, or a booster dose to be administered to Pfizer recipients 5 months rather than 6 after completion of their initial vaccination series makes sense. They've got a better view of the data and the practicalities than we do. And we really got to follow their lead. CDC's Advisory Committee on Immunization Practices is meeting today to consider that, translating that legal authorization into a clinical recommendation. I would expect that they will, but let's stay tuned for that and further developments with respect to other timelines. And I really have to defer to the national experts on that. They're the ones who have the visibility on the data and the knowledge and experience to make those calls.
And the last question I see is, can you speak to the impact of the cold weather closing county-run testing and vaccination sites?
Well, not helpful, right? Our testing site was down for basically a week, so that's roughly 2,500 test opportunities down the drain for the community and about 2,100 vaccinations. So we're that far behind. And thank goodness we're back open again. And as I said, we're in discussion with the state about how we might be able to expand capacity and try to muddle through as best we can and provide that service.
I think that's it. Thank you.
That's all the questions we have for today. We'll go ahead and wrap up. Thank you for joining us today, and please stay tuned for future media availabilities. Stay safe out there.